Hey, it's Dr. Rahman here at the Dr. SR Clinic. I hope you're all well, and this quick video is just to publicise a service that many of you may not know about, but which we've been introducing for some time now in the clinic, and that is injecting of the joints. Now, a lot of people have problems with arthritis, and osteoarthritis particularly is a lot of problems as we get older. The joints start to wear out, they don't move as effectively, and you get pains in the joints. A lot of people take painkillers and so forth for those, but obviously they can have side effects, and they may interact with other medications. So a lot of patients, of course, in general practice will have injections into the joints, so using a steroid injection to go directly to the joints to help with pain relief, and they work really well. Of course, the problem is that that's not always available at your GP surgery, or you may have to be referred to orthopedics, and that can take many months. So good news is that here at the clinic we can get it done quickly and with very little waiting time. So which joints are most popular? Well, by far the most popular joints are the knee joint and the shoulder joint. So we treat joints which are stiff, which are painful, and where the movement is reduced. The other things which are very popular are for the wrist joint, and also for things like the elbow, tennis elbow tendonitis, very common, and one which can also be injected with steroids. So knee joint injections are extremely popular and commonly done. The trick with knee injections is always finding the space between the kneecap and the femur there. There is a gap right there, and that's where knee injections occur. So if you've never had one before, this is basically how we carry it out. Right into the joint, steroid and a bit of anaesthetic, and Bobby's your uncle. Now, thing to bear in mind is that if you have a bit of a worn out knee, that gap is going to be a lot narrower, which is the reason why, a nice easy knee like this, but then you wouldn't be injecting one because this is an easy knee. So again, the skill involves finding the gap, which is only be done by somebody who is a trained professional. And so the other joint most commonly injected, we tend to do the shoulder, and that involves finding the gap between that part of the bone there and here, space down there, and goes directly into the joint like so. The other way that you may have had it done in your surgery, and the way that it can be done depending on where the pain is coming from in the shoulder, is coming in from the back and injecting this way. This gives you a more direct approach to the joint, but it is harder to do. So the side-on approach tends to be the preferred one. As I say, it depends upon where the pain is coming from, it depends upon how your examination indicates where we need to inject. And lastly, when we think about elbows, so if you have swelling around the elbow, or if you have fluid collected around the joint, which often happens, then we can drain that off using a needle as well. But again, it's really important to understand that these should only be carried out by people who have expertise in these procedures. That's a little demonstration of what we offer. As you say, these joint injections can be carried out very safely and effectively if they are done by a trained professional. They should never be done by somebody who isn't trained and who hasn't spent time around these joints and understanding safety things like infection control, direct, careful examination of the joint, knowing what it is that they are injecting into. It may look straightforward and simple in YouTube videos, but it takes a lot of practice. So if it's something that you're interested in, we at Dr. SR can help. So please click on the link below, get in contact with us today, and we'll help you.